pleasant good afternoon to Ms. Larice, as Group 5 has the pleasure of conducting today's presentation on case scenario 6. The group members include Christopher Jagna, Gabriel Sami, Hannah Maria Kong, Rondell Hongping, Chanel Ramswarup, and myself, Mariah Gonzalez. So today we'll have the overview of the theory, which would be Orem self-care theory, as well as discussing the paradigms, the assumptions, etc., as well as the relevance and the application of the theory to the case scenario, the pathophysiology of the presenting condition, nursing care plans, and finally a conclusion.
A 4-year-old child of a single mom was admitted to the hospital for nausea, vomiting, and loss of appetite.
She doesn't want to eat anything at all, doctor.
Upon admission, the medical officer realized that the child was Down syndrome. She had a flattened facial profile, a bilateral single crease across the palm, a sloppy forehead, a small mouth, a large tongue, and a decrease in stimuli. She also appeared to be dehydrated, pale, and weak. She had a temperature of 37.5 degrees Celsius, a pulse of 125 beats per minute, a respiration of 39 beats per minute, and an SpO2 of 89%.
My child has never been to the hospital except for immunization. But since her birth, she was advised to see the pediatrician, and honestly, I've never carried her because my pastor told me that my child's condition was because of the consequences of my past sins. Honestly, doctor, the last 4 years has been very difficult for me, and I'm feeling like if I literally cannot bear it anymore. My child can't walk, she can't talk. I'm feeling as though I'm living with a 1-year-old baby for 4 years, and it is very draining.
The management of this child will be discussed. An overview of the conceptual framework. Dorothea Elizabeth Orem, Self-Care Deficit Nursing Theory. Biography. Born on the 15th of July 1914 and died on the 22nd of June 2007, being 93 years old. Born in Baltimore, Maryland, she was the youngest amongst 2 daughters. Her parents weren't so fortunate as her mother was a housewife and her father mason. In the year 1931, Dorothea Orem graduated from Seton High School. In 1934, the Providence Hospital School of Nursing, located in Washington, D.C., gave Miss Orem a diploma. After receiving these levels of education, she furthered her studies by attending the Catholic University of America, achieving her Bachelor of Science in Nursing and Masters of Science in Nursing Education. Orem's self-care theory was developed to focus on individuals' ability to perform self-care, defined as the practice of activities that individuals initiate and perform on their own behalf in the maintenance of life, health, and well-being. The self-care or self-deficit theory of nursing is composed of 3 interrelated theories: theory of self-care, the self-care deficit theory, and the theory of nursing systems. It is further classified into wholly compensatory, partially compensatory, and supportive educative. In this instance, it focuses on the trisomy 21 patient in the scenario given and assisting the child's mother to give the best care possible to a 4-year-old.
Relevance and application of the theory. Since Dorothea Orem's self-care deficit theory was implemented for assisting in the care and purveying self-care to, amongst others, to institute and accomplish life, health, and well-being on their own, this theory would be relevant to the scenario. So nurses would apply this theory to those patients who are incapable of taking care of themselves on a daily basis, as observed in the scenario. The autonomy used by the nurse should be able to identify when patients are unable to dress, feed themselves, maintain hygiene, motility issues, frustration, etc. The nurse should firstly gather history on the patient to strategize what ways to work and help the patient with their needs. In order to achieve the personal care of the 4-year-old girl, the nurse would have to implement support, education, educate, guide, and bestow a habitat that would promote personal growth in order to obtain future health requirements. These solutions should be helpful to the RN in staying mindful, but also realize the power the patient has to become independent and have control during the stages of rehabilitation and treatment. Additionally, in the mother's case, the RN would want to intervene by assessing the mother's understanding of the disorder, Down syndrome, trisomy 21, frequently counseling her and promoting emotional support and motivation during this time.
Pathophysiology of the presenting condition. Down syndrome is linked to an additional copy of chromosome 21, which occurs when chromosome 21 fails to split during gametogenesis, leading to an additional chromosome in all body cells. The other two causes of trisomy 21 are Robertsonian translocation and isochromosome, also known as ring chromosome. In Robertsonian translocation, the isochromosome is formed when two long arms divide rather than the long and short hands. This happens in less than 5% of patients. Chromosome 21's long arm is attached to another chromosome, usually known as chromosome 14. Because of a division error after fertilization, mosaicism has two distinct cell lineages. The most frequent kind of Down syndrome is trisomy 21. In all cells, the person possesses 3 copies of chromosome 21 rather than the usual 2 copies. This is caused by aberrant cell division during the sperm and eggs development. Mosaic Down syndrome is an uncommon variant of Down syndrome in which a person only possesses an extra copy of chromosome 21 in a few cells. After conception, aberrant cell division results in a mosaic of normal and defective cells. Translocation Down syndrome, a condition in which a fragment of chromosome 21 can become connected to another chromosome before or during pregnancy, causing Down syndrome. This is where the individual has 2 copies of chromosome 21, but they also have chromosome 21 genetic material connected to another chromosome.
So after assessing the patient, objective and subjective data were collected. So under the subjective data, we have the flattened facial profile, a bilateral single crease across the palm, sloppy forehead, a small mouth, an enlarged tongue, and an important decrease in stimuli, as well as dehydration, a pale complexion, and weakness. For the objective data, we collected the vital signs, a temperature of 37.5 degrees Celsius, a pulse of 125 beats per minute, respiration 39 beats per minute, and SpO2 of 89%. So as seen on the table, the pulse, the respiration rate, and the SpO2 are high for this child's age, but the normal range for such should be a pulse of 80 to 120 beats per minute for this child's age, as well as a respiration. The respiration should be 20 to 28 beats per minute, and the SpO2 should always be 100%. So because of these findings, we gathered 3 nursing care plans. Nursing care plan 1 and diagnosis 1, deficient fluid volume related to dehydration as evidenced by the increased pulse rate. Planning or goal. So for the short-term goal, the patient will be normovolemic as evidenced by the heart rate of 60 to 100 beats per minute. A long-term goal, the child's mother will be educated and counseled on the awareness of the causative factors and the behaviors essential to correct this fluid deficit. Intervention 1, monitor and document the vital signs, especially the blood pressure and the heart rate. Rationale for intervention 1. Deprivation of fluid results in hypovolemia. With an increase in heart rate, the body's compensatory mechanisms is activated to maintain fluid volume and cardiac output, ensuring that the blood is delivered to various organs. Intervention 2, assess skin turgor and oral mucous membranes for signs of dehydration. Rationale for intervention 2. Dehydration symptoms can be also seen on the skin. Skin turgor should be evaluated over the sternum or on the inner thighs, as well as any signs of longitudinal furrows around the tongue. Evaluation. The patient has a pulse of 60 to 100 beats per minute. Evaluation 2. The child's mother is educated and counseled on the awareness of the causative factors and behaviors essential to correct this fluid deficit.
Diagnosis 2 is delayed growth and development related to impaired ability to fulfill developmental tasks. Planning, or the goal, the short-term goal would be the child will be able to establish a method of communication in which needs can be expressed. Long-term goal, the child will be able to perform age-appropriate self-care activities with assistance by the mother or by the parents. Intervention 1, encourage the patient's parents to regularly check the patient's hearing and vision. Intervention 2 would be to educate the parents on the disease and the type of care needed. Intervention 3 would be to provide strong support and guidance before and after birth. Intervention 4 would be to educate the parents on proper nutritional habits and diets for the patient. Rationale, regular exercise and proper diet is required for any child to grow both mentally and physically, allowing for proper growth and development of the body and brain. Strong support and guidance groups aids with reducing parental stress, allowing for the parents to keep up with appointments and schedules. Evaluation, the child communicated in which needs were expressed, and the child was able to perform age-appropriate self-care activities with the assistance from the parents.
Diagnosis 3. Impaired parenting related to knowledge deficiency as evidenced by non-compliance with health practices and medical care. Planning or goal. Short-term goals includes effectively teaching parent on management of Down syndrome child. Long-term goals, establish a method of communication whereby the child can express. Create an environment, trust, respect, openness, and collaboration. Intervention 2, provide clear, concise, comprehensible explanations and demonstrations. Encourage questions. Intervention 3, aid parents in identifying community assets for continuing information and support. Or referral to a pediatrician, physiotherapist, speech therapist, and special education institution. Rationale. Demonstrating respect is essential when providing education to persons of different values and beliefs about health and illness. Patients are better able to verbalize concerns when they contain basic information about what to expect. Questions to facilitate open communication between patients and healthcare professionals allow verification of understanding of given information. This will promote parents to portray appropriate health and medical care. Finally, evaluation. After 2 hours of nursing intervention, the parent is able to discern a basic understanding of the Down syndrome disease and care that is required towards her daughter's health promotion.
Conclusion. In conclusion, we observe the efficiency of each theory as it is not just for reading, but it goes to show that each can be applied to real life situations as a guideline for RNs. Given the circumstances, Orem's theory did provide a recovery method for the patient-centered care using an assessment and care plan to intervene on behalf of the 4-year-old child's mother. The RN would ensure that every need is met, improving the child's independence. According to the theory, well-being and the maintenance of adequate health is initiated by the individual's ability to perform self-care, but based on the scenario, as well as the interventions and irrationals initiated from the nursing care plan. As a result of the child's age and the unfortunate Down syndrome illness, there may be some difficulties to perform such tasks by herself. This is where educating the mother is very important. Taking care of the child would eventually become less of a burden on the mother as she gains knowledge and techniques used by the RN in routine care. The mother will be able to teach and assist the child in long-term care. For example, the mother will be able to discern a basic understanding of the Down syndrome disease and care that is required towards her daughter's health promotion. The mother should have a better outlook on her daughter after previously having deterrent thoughts about her child's disability. And lastly, the performance of self-care activities with the assistance of the mother. With that being said, we would like to thank Ms. Larice for listening. The end.